Okay, so here we're going to look at the diagnosis and management of these conditions in regards to overhydration and dehydration. All right, so one of the things that we're going to be doing throughout this course is I'm going to tie in a lot of the clinical correlations, and the reason is really twofold. Number one, you're going to be doing this when you get into your professional programs, and it's really important to understand how the basic science relates to these clinical conditions. All right. The other part too is that, man, it's just fun. It gets you excited about what you're going to be doing with your life. At least it gets me excited. So I want to tie these in. A lot of times students are really motivated by this. They remember it. They'll remember stories and cases before they'll remember all the nerdy details. But if you can remember the nerdy details because you know the story, a lot of times that really helps. So I like to include this in my lectures. When I require for you to recall some of this information, what I want you to understand as far as like diagnosis and management, I'm not going to expect you to remember names of drugs. What you may want to do is understand, what does that drug do? So drugs that do X, Y, and Z. You don't have to remember the name of the drug until you have pharmacology, but at least know what that drug would do and how it would manage this condition. The other thing too, a lot of people have anxiety when they see numbers. Like here, we're looking at the serum osmolality, normal range of serum osmolality. I will always give you the range. What you'll need to do is you'll need to interpret it. Okay, so what does it mean when it's below 275? What does it mean when it's above 295? And how do we apply that information? Okay, so you'll never have to memorize those numbers in my class. However, when you get to your professional programs, you're probably going to have to memorize labs and dosages and that sort of thing. For my purposes, I want you to understand how you use it. So when it comes time for you to memorize those numbers, you already know how it works. You just need to memorize the numbers. Okay. So here, let's look at the clinical application in osmosis. All right, we're looking at the diagnosis. The two things that we're going to look at is we're going to look at the osmolality of blood or serum. All right, and we're going to look at osmolality of urine. All right, when we look at osmolality of serum or blood, again, our range is 275 to 295. I don't care that you know that, but I want you to know what it means when it's above that or when it's below that. So when it's above that, that's going to be considered dehydration, because remember, there's more solutes, less water. So that would indicate dehydration. When the serum osmolality is below that, all right, and remember, we're talking about the external environment here. When it's below that, we would consider that overhydration, right? Because we have less solutes, more water. All right, as far as urine osmolality, this is where we're going to be dumping out the extra electrolytes, extra fluid. Okay, so urine osmolality is going to be increased in dehydration. All right, it's going to be decreased in overhydration. All right, so that means when it's increased in dehydration, it's going to be concentrated urine. All right, we're going to get rid of some of those solutes. We're going to get rid of less water, more solutes. Okay, in overhydration, we're going to get rid of more water, less solutes. Now, as far as the management of dehydration, if it's mild to moderate dehydration, we can just, give fluids, give oral fluids, even with balanced electrolyte balanced solutions. So this is where, you get stuff like Pedialyte or, some of the sport drinks for athletes. All right, now in severe dehydration, you're going to have to supply IV isotonic fluids normally, a normal saline, in order to restore that extracellular volume. Okay, now overhydration, obviously, we're going to stop the fluid intake, or at least restrict fluid intake, as well as give diuretics to remove some of that excess fluid. Okay, and then we'll also have to balance the electrolytes to make sure that that you're not diluting out, or you're not you're not pulling off too much fluid where it leaves electrolytes that will cause other shifts in fluid. So when we give that, or when we take off some of that fluid, all right, we can change those electrolyte concentrations.